Brilliant. So good afternoon. I'm thrilled to welcome you to the second panel session, which is entitled How to Use AI to Benefit the Black Community, where we're looking to discuss how AI can help the Black community, but really around, but also around the obstacles and the need to overcome to make greater progress. So I want to start off with just qualifying this with, of course, that we know that AI has proliferated our society with immense promise to solve the world's greatest societal challenges, from tackling climate change to improving access to services. But we've also witnessed the challenges that the AI community faces to ensure that such technologies can benefit all. And in fact, that some development of AI tools have actually shown it could marginalize Blacks and other minoritized communities, further exacerbating inequality. So this session is bringing together AI researchers from the Black and Afro-Caribbean community, who are working in different sectors and making great contributions to the field of AI. As Sharon said, I'm the chair of your session, Anjali Mazumber. I'm the theme lead on AI and justice and human rights at the Alan Turing Institute, where I also wear the hat of research chair for equality, diversity, and inclusion. I'm a statistician by background, whose work is at the intersection of data and algorithms and issues of justice and equality. And also as a research chair, following earlier this year, the AI UK conference in March 2021, we had a particular session that was looking at how to do data science and AI better, from issues of data representativeness to diversity in research teams. And the Institute is now embarking on a program of work to try and address some of these issues and considering its role as an employer, a research institute, and as a national body, and also to try and consider what our role and responsibility is as individuals. So this session and this workshop today is really at the heart of my own interests. So as mentioned before, the panelists here today will share their thoughts on how AI can be designed to be more inclusive and what are the opportunities and barriers to achieving such inclusivity. So first, I'll introduce the panelists, and then I'll ask each of the panelists to take about 5 minutes to share a little bit about themselves, their research, and what drew them to their work before we shift to the Q&A session. So in no particular order, we have Dr. Jerone Andrews, who is a research scientist at Sony AI. He works on general image processing tasks within Sony AI's gastronomy and AI ethics flagship projects. He has a doctorate in computer science from UCL, and his research interests and expertise extend across computer vision and deep learning. I hope that we've had Shamima join us now. So Shamima Kaliisa is the founder and executive director of Chil Artificial Intelligence Lab. She is an AI developer and entrepreneur who uses technology to help offer cancer diagnosis systems through cervical and breast cancer testing kits, and supports treatments with a proprietary system that offers e-oncology services like consultations and test result interpretations through a mobile app. Her work is currently based in Uganda, and she utilizes drones to help reach villages and remote areas to ensure that as many women as possible can access this life-saving service. We also have with us today Mavis Machiviori, who is a social scientist at the Ada Lovelace Institute, where she works on interrogating impacts of data-driven systems with interests in understanding health and data-related inequalities. She combines her knowledge from her doctorate in health studies with a midwifery background and medical anthropology training towards research on health and genomic data governance. And she's particularly interested in questions about inequities and the experiences of different members of society. And then last, but definitely not least, is Shakir Mohammed, who is a senior research scientist at Deepmind, a member of the Royal Society Diversity Committee, and a founder of the Deep Learning Indaba that is committed to strengthening machine learning in Africa. His work ranges between foundational machine learning and generative models to addressing the more ethical and socio-technical factors in AI. He works on developing methods that are focused on probabilistic reasoning that lead to systems for agent-based decision-making and applications of machine learning to global challenges in healthcare and environment, as well as social transformation that supports greater diversity, responsibility, and freedom. So it's my absolute pleasure to hand over the mic to our panelists now. So again, I'm going to ask each of them to take about 5 minutes to introduce themselves, tell us a little bit about themselves, their research, and what drew them to this work. So if I start with Jerone, be all right?
Sorry, I don't think I'm hearing what's being said.
Jerone, can you speak? I can see that your microphone's on, but I can't hear you.
We can't hear you. Can see that you're...
Yeah, we can see you, but we can't hear you. I can see that your microphone is unmuted.
Hello?
Yeah, we can hear you now.
Okay, maybe there's something wrong with my headphones, but can you see my screen?
Yes, we can.
So I need to say hi, everyone. And first of all, thanks to Sharon for inviting me to participate. So my name is Jerone. I'm a research scientist at Sony AI, which is Sony's recently established flagship AI company. So to give you a quick overview of my background, I started out by studying maths at King's College London. And during my MSci, particularly while completing my final dissertation, I became increasingly interested in machine learning. So I went on to complete a PhD in computer science at UCL, science group. He worked as a postdoc after being a research fellowship. While at UCL, I also spent time after this trip in mathematics in Tokyo, telephone research in Barcelona, and I also completed the same computer fellowship.
Jerone, sorry, I think you're breaking up a little. It's really difficult.
Can you hear me now?
Yes, but the volume is still quite low.
Okay, 1 second.
Can't hear. It was better earlier with the previous headphones.
We can't hear you at all. Jerone, I'm just wondering, do you want to try and navigate, and then I'll ask one of our other panelists to...
Yes, I think that's a good idea. If we go to another panelist, we'll try and work out what's going on with Jerone on the side. Thank you.
Shamim, would you like to... I think I saw that you're here. Shamim Nabuula, Kaliisa, if... Can you hear me?
Yes, I heard that.
You need to... Oh, we can't hear you. Can you unmute? Oh. Thanks, Jerone. We can't hear you, Shamima. Can you unmute? You're still muted according. Can anyone else hear?
No, I'm afraid the muting's.
Oops. Does someone have the power to unmute?
I've invited her to unmute, but unfortunately only Shamin can unmute. It might be that you might need to log out and log back in again, Shamin. Do you want to go to the next panelist? Hopefully we're going to get somewhere. I apologize for the technical issues.
Thank you everyone for your patience. So we'll move on to Mavis. Mavis, hopefully this will work.
Fingers crossed, you can hear me? Okay,
Yes.
great.
Brilliant.
I'm really looking forward to hearing Jerone and Shamima, so hopefully we can get them back in. But in the meantime, hi everyone. As you've heard, my name is Mavis Machiviori. I have a little bit of a, I guess, not so straightforward path to where I've gone, but I will tell you a little bit about it. So you heard that I am a midwife by training. I have been in clinical practice for 14 years and left clinical practice about 3 years ago now. And I guess one of the things that slowly emerged over time is an interest in understanding how patients and the interaction between clinicians was documented and coded, and how that generated insights about kind of the interventions that people then had from the health data. And I think through my work and also working as a research midwife at that point, I quickly realized that the ways in which we decide to code information actually has implications for what we can know about people. And embedded in that is a lot of biases about what we think is important to record and not to record about people. This is information that doesn't really get interrogated later when, when researchers then access that information or data and kind of, make these linkages. I think it's taken as if that work or that information about people is objective, but actually, kind of behind the scenes, there are all these biases and all these decisions that we make about how we code the data and how we generate that information that, doesn't get kind of embedded in the decisions later down the line. And I think this has huge implications in terms of what we can know about people, and especially when we then turn to information that then is used to create models about health and who gets prioritized for health. There's the systematic and systemic biases and racialization of people that is missed in these systems. So over time, I've started to really kind of reflect on the work that I've done as a midwife and how those insights can really be useful for understanding the ways in which people are missing in data, and how we can try to then bring those people back into the data. So really being intentional about what we mean by, especially for instance, thinking today about the Black community, what we mean by being Black. And these are terms that we use quite often, but mean very different things to the people that we use to describe using those terms. As somebody who is from Africa, as a Black African woman, does being Black in the UK mean the same thing as somebody born in the UK? Those experiences are very different, but sometimes when we look at the data, those experiences are not shown. So when we start to think about whether AI can be useful for this, it's something for me that I always try and imagine what could make these experiences more known. Is there a way in which we can use AI to really kind of embed these experiences that people have? So some of the work that I'm doing at Lovelace is looking at a systems approach of, say, the NHS and the ways in which health data is used, the ways in which people are missing within that data, and how that has downstream effects on kind of impacting what we can know about people, how to look after them, and how to generate kind of further insights from the models that we build. And one of the other things that I'm really interested in is the linking between big data, AI, and genomics, because again, in genomics, there's usually an understanding that we can use AI to generate personalized healthcare, but actually that also depends on the quality of the data that we have. And some of you might know, but in genomics, there's a big diversity problem where a lot of the information comes from people of European heritage, and we're meant to then use that information to build insights to create personalized medicine for people who might not be represented in that data. So these are some of the things that I think about and hope would be useful to some of the discussions today. And yeah, I'm excited to be here, but I'll pass it on back to you, Anjali, and hopefully the others will come back.
Brilliant. Thank you very much for that, Mavis. Shakir?
I'm hoping this is gonna work, but maybe you don't see me anymore, or let me start it again. Okay, see me, hear me? Yes, success. Okay, hello everyone. It's great to be with you all. A happy Black History Month, even though part of what I want to say is that we shouldn't be celebrating in this particular kind of way. So my name is Shakir. I use the pronouns he or they. And I have many different stories as to how I come to do the kinds of work that I do. So I'm a research scientist at Deepmind. I'm also an honorary professor of UCL, and I have an associate fellowship at the Leverhulme Center for the Future of Intelligence at the University of Cambridge. And I try and bring all of these things together. So in my technical life, the thing I'm probably most known for and the thing that I've always been interested in working in is what are called generative models. So these are models that we can build of data that learn probability distribution. So it's all about learning the statistics of the world and how that statistics can then be used to generate data that we have observed, futures that we may see or have seen, we can generate in the past, the future, or the present. And this role of generative models, I think, has become, over the course of my own career, one of those very big, important topics that we've worked on. I suppose one of the things that's very natural for everyone who's working in generative models is the idea that there is a generating process underlying data and the systems that we study. And so if you are serious about doing work in generative models, then I think you'll take this idea, the philosophy that there is a generating process as far as you can. So it's not only that there is a generating process of the data or the system that we're studying, but there is also a generating process underlying the kind of society that we are in. And that this society and this data, the algorithms that we are in, they're all interacting with each other and creating a very kind of complex data generating process. And I suppose for the generative models researcher, our work is always to discover this generating process, to account for this generating process, to say where it is we are not going to make capture the generating process correctly or smooth it over in other ways. So this is where I think our conversation today enters, that we are entering a space that is very complex, where algorithms, where data coming together in this form of machine learning or of AI, however we are calling it, and then they are feeding, they built on an existing generating process. They are reproducing elements of this data generating process or this life generating process, if we also wanted to go in that way. And so if you are thinking about generating processes and the role that it has for all of us as Black communities, as communities of color, as people who are living different kinds of lives, experiencing the world in very different ways, then I think we need to have a very broad spectrum of all the different areas that we consider, whether they are historical, and I think the historical element of our generating process is fundamental. And one of the messages I want to say, although we want to celebrate Black History Month and how vital and important it is for us to celebrate that, what many people forget is that Black History Month is not about celebrating Black history in that particular way or having a month for people who are Black to celebrate history. It is to recognize that the history of Black people is all of our history. And that history is central to how we think about the world, how we need to grow, and how we are going to develop our work. So I think fundamentally, a large part of my work, as we are thinking about the role of AI in society, has been to consider those historical dimensions. Where is it that racism enters? How is it that different forms of colorism? I really liked what Mavis said, that for those of us who are born in Africa, actually the concept of being Black doesn't quite manifest in that way. We have many different forms of other xenophobic discriminations, or colorism is a very important one, and other kinds of things. So I really connect with what Mavis is saying about that kind of lived experience. Of course, the technical is vital because it is the way that we reproduce work and we generate things. The kind of values that we bring to our work is important. And I think if we bring all of these things together, that is sort of one way we can maybe address the question of this panel of how AI can help the Black community. Although I'll just say that in my technical work, I actually work in a different area that we will call socio-technical systems. And socio-technical systems are sort of to make all of this a more formal area of study, to say that actually the technical systems that we work with and the society that we deploy those systems in are not separable things. You don't have a space where technical systems are designed in the lab, in the corporation, and then put into the society, and then they do amazing things. Rather, there is always this kind of conversation between society and technology that's going on. Society can help us build better technologies, and of course, technology can have the reverse. It can cause harms in technology. So all the work of socio-technical systems is to bring these kind of areas of society and technology together in this very deep question, to ask questions of where is it that harms can come from, that we can't always be, of the AI researchers, always looking for positives without thinking about where it is that risks are being spread in our community. So I suppose the message maybe of socio-technical systems for our conversation today is that it would be incorrect to ask a question of how AI can help the Black community. What we should ask is more a mutually inclusive question. Is it that the Black community can help AI be better? And then in turn, what AI does for the Black community, and what happens when that conversation comes together, and what kinds of things happen? Of course, systematic racism and reproducing things when we use poor data manifest, but there can be other kinds of things where we actually reveal disparities in society and then give us levers with which to attack them, to modify them, and to change. So maybe later on I'll share a few stories, I think, of where these things come up in all the different complex ways, and then we can pick up a bit together. But I'm so excited to be here. I love coming to speak at UCL, and this amazing panel is just such an inspiration. So let's really hope that the sound works for everyone else. Fingers crossed for all of us. And thank you again for having me here today.
Thank you so much, Shakir, for that. And I definitely want to pick up on some of the points that you raised, and particularly in terms of framing things as what the Black community can do and is doing for AI, rather than what AI can do on the other side. So Shamim, can we see if your sound is working? Oh,
Hi.
yes, perfect. We can hear you.
Yeah, can you hear me?
Yes.
Yes. Yes. I'm Nabuula Shamim, a co-founder of Chil, and I'm an entrepreneur. Yes, I was selected among those top 30 people that are using technology to influence the world by Bloomberg New Economic Catalyst. So I want to talk more about what I do and what really motivated me to do this. Yes, coming from an African background, and despite the challenges that you go through, I love creating a positive out of it. And then it's that I am a breast cancer survivor, yes, but then from that I say I have to do something that would influence my community, and that is what Chil does. Chil uses the power of artificial intelligence to help they are women actually. Okay, let me bring it in a clearer way for people to understand what Chil does. Okay, for Chil, what does it provides e-oncology services to women, and that is it enables them to acquire telehealth services in such a way that a lady does not have to move from where they are, because it's an African setting and these are the Blacks, and you know the bit of the community that people are used to. So the use of AI in such a way that it helps people that if in case they would want medical records interpretation that is going to be done by our company. If they would want consultation with doctors, with consultants, that is also going to be done by our company. And we also go on to create education about their health, mostly cancers, chronic diseases, diabetes, and all that. So why I incorporated the use of AI in this is because you look at the Black community and everyone perceives AI to be for the other people. But then we look at it in such a way that this is something that can be done by also the Black people. They can do it actually better and then be able to deliver services to their people. I'm talking the entrepreneurial side, because I have a business that is doing all this, but then the incorporation of AI in whatever we do is really critical. For example, I can give an example of most of the Black people that we are working with. When you're using the power of AI, there are positives and negatives that usually take place. For example, you realize that the data that is usually there is favoring a different color that is not for Africans, because you realize that the people who are going to train all these things are non-Africans or they're not Black. So all that information is not going to really impact a lot onto the Black people. But this is something that, yes, the Black people are working with. And then why I would love to emphasize today is that the data for the Black people should also be something crucial, so that what is delivered to them is really for their lives, for them to improve their health sector. So in such a way, as Shakir was talking about, we should not be celebrating the Black History Month or something. No, what are we looking at? We're looking at how the Black people are using AI. How are they benefiting from this AI? Because most of the Black people may look at AI and this sector, but then what is going to happen like 5 years from now, 10 years from now? Because the world is changing. The pandemic came and things changed. So what is going to happen after years that have gone by? How are we going to be able to transform our different sectors that we're working in? Because some sectors are being affected. Yes, AI has brought a positive impact. For example, it has assisted maybe in the health sector. It has assisted in the predictive technology that, yes, you can know this is person's data is saying this, that EMR records are saying this, so I think you're going to suffer from such a disease and all that. But then how are the Blacks included in this? And how is it helping them that they can be able to know and then be able to improve their health, improve their lives, even in the bit of the other sectors, maybe education, research and all that? How is it going to help them be able to impact their communities wherever they are? Yes, we are doing the research, but then the community is what we're doing it for. But if the community does not feel the impact of what we are doing, again, they will still be left out in this. So that is where my argument is. The Black people are supposed to be included more, so that their data is also critical, applying to them, not specifically to a different trace or something, because we are not usually the developers, but we usually use technology from somewhere else.
Thank you very much for that. Jerone, can we see, hopefully, fingers crossed?
Can you hear me now?
We can.
Okay, I just had to switch computers. Could Sharon make me co-host again so I can share my screen, please? Because I had to rejoin. If Sharon's there. Thanks. Okay. Can you see my screen and hear me? Okay, great. So I'll try to go over this quickly. So basically, I was at UCL for 7 years as a postdoc and doing my PhD and my MRes. And since January this year, I've been working as a research scientist at Sony AI in Tokyo, which is where I am now. So it's 11:30 p.m. And I jointly contribute to the AI ethics project and gastronomy project here at Sony. Broadly speaking, my research interests are in computer vision and deep learning. So before at UCL, I was in the Vision and Imaging Science group. So focusing on AI ethics, recently I've been looking into research questions relating to visual data sets and visual biases. So I guess the ground importance of this is often useful to acknowledge that each and every data set represents an isolated view of the visual world. So things like discrepancies between data found in real world deployment contexts and data used for training and evaluating AI systems can result in unexpected failures. So this is such as when a model solution differs from the solution we would have liked as humans. For instance, when a model solves a task by taking shortcuts. So in this example, adapted from a paper called Women Also Snowboard, an image captioning model generates captions containing gender nouns, but it doesn't really look at the person depicted. So the model just exploits contextual cues such as tennis rackets to determine the gender of the person, as opposed to wholly examining the visual evidence. And shortcuts are undesirable because they can perpetuate societal biases. So I've been working on developing solutions that, for instance, manipulate images so as to mitigate biases like this. I've also been working on best practices and guidelines in order to collect, organize, and present more ethically minded data sets. And one reason why this is important is that it can help prevent questionable uses of image data sets, such as those which attempt to predict a person's inner state on the basis of their external features. And these include pseudoscientific tasks such as predicting intelligence, criminality, and hireability. And interestingly, there's an ongoing debate in the field of psychology since 2019 as to whether a person's emotional state can be universally inferred from an image. Beyond this, I'm also interested in auditing tools, so tools that can be used to evaluate the visual diversity of image data sets. So in order to reduce certain biases, it's important that data sets are representative. For instance, data sets of people's faces should accurately represent the visual diversity that actually exists within and across all demographic groups. And I'm explicitly focusing on visual diversity here, as opposed to balancing subpopulation attributes, since having a balanced data set does not guarantee that the samples are visually diverse. So if we solely concentrate on balancing data sets on the basis of demographic labels, for example, by representing large groups of people under a single racial category, we may simply be masking disparities and reifying stereotypes. But I'm not completely disavowing the balancing of data sets based on demographics. Sometimes this is necessary for practical reasons. I guess I'm just trying to underscore that demographic balancing doesn't always capture all of the relevant diversity, and it can also entrench stereotypes. So ideally, at least in computer vision, we should move towards more nuanced methods for auditing and improving dataset diversity. So sorry if I spoke quickly, I was trying to make up for time, but thanks for your time, and feel free to get in touch if you have any questions or you'd like to discuss any of these topics in more detail.
Great, thank you very much to all the panelists. We're going to shift to our Q&A portion of this session. And I'd like to kick off with a question, which I hope that the panelists will also potentially pick up on what each other have said, as well as some of the other, what they've already started to allude to as well. So to kick things off, I'm going to put to the panelists, how can AI be designed to be more inclusive? And what are the barriers to achieving inclusivity? And while the panelists formulate their thoughts there, I'd also just like to encourage the attendees here to post questions in the chat that we'll try to pick up on. So Jerone, I might just ask you to kick things off. That's all right.
I guess how AI can be designed to be more inclusive. I think one of the things is that people often talk about the models being biased, but I mean, well, they're trained on biased data, but often things like image data sets, they're also they're determined by who labels them. So things like talking about, I don't know, there's a great paper called One Label, 1 Billion Faces. So for instance, putting everybody under the category Black or Asian or white isn't necessarily sufficient, well, it's insufficient to, if you want to talk about how those groups vary and how all the subgroups that are in that larger group. So I guess for inclusivity, I think that when we're creating data sets, we need to involve more, well, all of the people who will be affected and be more careful about not just the demographic distribution in the data set, but also demographic distribution of the people who are creating and labeling the data sets.
Great. And as a sort of follow-up to that question was, what would you say are some of the barriers to achieving some of that? And you have sort of framed it in one way, but would there be suggestions that you have or points that you'd like to raise?
I guess. So the barriers to achieving, let's see, I guess the barriers are probably the fact that there maybe aren't enough people thinking about this in research. So everybody is focused on creating great AI models and getting better accuracy for things like face recognition, but people aren't necessarily thinking about who's creating the data sets, and also things like the consent, how much you're paying the people to annotate the data sets. If you pay them too little, then they're not going to do a good job because they need to balance their time with the amount that you're paying them. So I think that maybe people need to think about, these kinds of things from the beginning. So yeah, and also think about the uses from the beginning and how you're not going to use data sets and how you're not going to use models, rather than waiting for things like, I don't know, some kind of failure case that happens in the media before you do something.
Really great points raised. Thank you, Jerone. I'm going to turn to Shakir now. It's all right. Mixing things up a little.
Thank you. And I suppose there's so many different ways of addressing this question. I suppose I wanted to start with, when this question comes up, then there's a kind of assumption that we all know what it means to say something is inclusive. And I think we're going to have to start there maybe, because I'm in the mood of being a little bit difficult today, to say, well, what do we actually want to be including in here? And I think Jerome was actually just pointing on some things. The typical answers that we have to start with are, of course, what kind of data, who's doing the labeling, or where the labeling comes from. Those are maybe more general questions of diversity in general, as Jerome pointed out, in the who's doing the work, who is thinking about these things. So diversity, of course, always comes up in these questions. I think what Jerome said, but I'll push it even a little bit further, is the general question of participation in the development of AI algorithms is another very important question. In fact, it's all the rage these days. Participatory AI is probably one of the biggest topics. I'm not going to say I'm not working myself in that topic. And the idea of participatory AI is that we can't develop algorithms without thinking about the people who the algorithms are meant for, and that they need to be participants in that kind of question. And there's a beautiful and very long theory about participation which exists, and if anyone wants to look it up, there's something called Einstein's ladder of participation. And it's one of the most beautiful theories, I think, of participation, because it gives us a linear measure of participation. It says you can have so many different kinds of participation. You can bring Black communities into the development of your AI, but it could be a form of extraction, because all you want is, just as you know from the example of the Chinese company operating in Zimbabwe, just you want their faces for your data set. That is outright exploitation. Or you can just bring them in so that you can say to everyone, to your investors, to the media, to your outside community, that you heard the voice of the Black people. So that's a kind of capitulation, a kind of tokenization that's not good. So all of these are not the kind of participation you want. The real participation that you want is a form of either empowerment or ability to affect the decision-making that comes from these things. So I think there's a really beautiful theory that we can bring up here. Maybe I'll just give one story, which I think will give a very particular way of how AI can be used to be inclusive, and you will see from the story the kind of inclusivity. I told the story a few days ago at an internal talk. So there's a city in the United States which is called Flint. Maybe you all recognize it was very famous because of a particular kind of crisis of water that happened in this city. Now, what happened is that the water situation was changed to the river, and when they did the change, they didn't treat the water with any anti-corrosive treatments. And so when the water went to the pipes, it started leaking lead into the water and started poisoning everyone basically in the whole city. Now, there's a lot of complexity around this story. Part of the story is that machine learning researchers at the University of Michigan then came in to help develop a machine learning predictive tool to help the city prioritize where they should test for lead pipes. And if you can test for lead pipes, then you'll know exactly where to replace. And that will be a good use of money. You'll be faster. You'll be safeguarding all the vulnerable communities. And I think actually this was a brilliant idea. And although many things went wrong in this story, and this is not a good story of the use of AI in the real world, what the researchers did is a good story. That they knew that when they got the data was about different kinds of neighborhoods, how many people were living, how many elderly people, how many pregnant people, how many children, proximity to other houses where they had found lead before, and they made this predictive tool. They realized that the data that they used, and I think Jerome and Mavis said this previously, was actually systematically biased. So what they did was a kind of randomized sampling to go into the city and actually get a more independent source of data. To actually support the actual database. And because of that, their data was so robust that in the first year that that system was actually deployed, they had a 70% hit rate on discovering lead pipes. Of course, that's exactly what you want, because then all the good things happen. Of course, then the bad part of the story comes after this, when the model was given to a different kind of company. I'll save that for another day. But this, I think, gives you a very particular kind of way of this question of maybe of how you can make it inclusive. And I think at the same time, we'll tell you about barriers. The company that took over didn't have the kind of institutional culture to think about that. They were not in the mode. They thought of this purely as an engineering problem. They didn't see it as a community-based problem. The community themselves, of course, they were poisoned by water. Why would they trust anything the government would do? So, of course, they were never going to trust machine learning. So there was zero public engagement and genuine participation, very little diversity in who was being spoken to. And then there's the kind of underlying racism of the society that started affecting them, where all of a sudden the richer or more whiter parts of the city started claiming that they were being treated unfairly in this kind of process. And then actually when they got taken to court, undid of some of the very good work before. So you see the kind of where you can have inclusion always comes with the same kind of barriers. And I think what we just need to do, if I just go back on that hobby horse, is if we analyze the system not only as a technical system, but we broaden how we think about machine learning problems to always include the social systems, whether they are the labelers of the data, whether they are the communities themselves, whether they are other companies and actors who are supplying certain kinds of services, then many of the problems that we see, particularly harms against Black communities like this particular story of Flint, can actually be avoided. And it is only because of neglect that we keep seeing these kind of problems. So I'll end there. Thanks.
Thank you, Shakir. And I think what's also great about our panelists too is that they're coming from really diverse backgrounds themselves, and both, from a technical standpoint as well. So we're getting, I think we're getting the range of views here to come out. I'm going to turn to Shamim, if that's all right. You can pick up on some of these threads here. Are you able to unmute again? Shamim Nabuula, can you? Can you hear us? All right. Maybe while she's seeing how to unmute. Oh. We'll come back to you, and I'm just going to ask Mavis to pick things up.
Okay, great. Nabuula, just feel free to jump in once you unmute, and I can continue the statement afterwards. But I agree, first of all, with Tisha, that it's brilliant just listening to Shakir, but also Jerone. Like I could listen to both of you just talk for ages about some of these issues. And I completely agree that it sounds to me, listening to both of you, that one of the underlying things is about who's asking the questions and why we want to use AI tools to answer certain questions, right? One of the things that we need to go a step back to is what is the structure of society? And I think once we figure out the structure of society, we can then see where AI is going to be useful or not. And kind of following the person that's been said already of giving examples, there's another great example, also not so great in terms of how it actually kind of didn't support Black communities, but I think could answer the question of, instead of asking what AI can do for Black communities, is what can kind of being more diverse and including people of color and Black communities within the design of AI. So this is an example also from the States, which was in the healthcare setting. And a group of researchers showed that in one group of hospitals where AI was deployed to decide who got prioritized for healthcare, Black people were actually not being prioritized because it appeared as if they had fewer healthcare costs. But when the researchers actually stepped back from the data and said, well, why is this? When we actually know that Black people have higher costs, it turned out that the algorithm that was being used was only measuring prioritization by the amount of money that was being spent per patient. But in a country where healthcare provision is so unequal, knowing the structure of society showed that insurance companies actually tended to pay less money to cover the cost for Black patients. And also people in the Black communities didn't manage to see their doctors as often or to get their diagnosis as often as people in more affluent communities. So it appeared that their healthcare costs were lower, but actually this didn't match onto the ways in which they experienced healthcare. And so when you just look at the data and not understand those communities and not understand the structure of society, you're going to just assume that AI or the algorithms that are overlaid on the data are perfect. And there's also recently work in the UK, there was an article in the Metro not too long ago of an Uber driver who couldn't access work because Uber kept I think it couldn't recognize his face. And so you can imagine at first you're like, oh, but it's just, facial recognition is a great tool, but if it doesn't work for you, it's you can't then participate in society. So you can't go to work because a tool has decided that it doesn't recognize your face. You can't, for instance, if everything is becoming, touchless or censored and it doesn't work on dark skin, then you can't wash your hands, you can't get sensors to, use hand gel, and already that puts you at an infection risk. So there are all of these different ways in which the same technology impacts people in different ways. And just to kind of finish, there's a great documentary by somebody called Joy Mini, who then started the Data Justice League. And in her PhD work, Joy found that her face wasn't recognized by algorithms. So I set out then to find out why this was the case. And actually then it emerged that a lot of the algorithms were trained on data that wasn't representative of populations, but also the people who were training the models were themselves not from the Black communities. So the questions that you would ask about, can someone see me on a Zoom call without me having to turn on the light? Like, people who don't have that problem are never going to think, well, how can we make these systems work for people with different tones of skin? But just to kind of jump from that to a question that somebody put about representation and diversity, I think it's also important to understand what we mean by diversity. Is it diversity of skin color? Is it diversity of gender? Is it diversity of experiences? Because if we don't quite interrogate what we mean by diversity, I think as Shakir said, what we're going to end up doing is just reproducing and missing some people in those data sets. And one of the things that then kind of worries me from a health perspective is we then verify kind of these concepts that are very socially constructed and say, well, we can add a biological dimension to it and that makes it biological, but that makes it objective, but actually all of these are all constructs. So how can we understand the ways in which these tools are embedded on all of these social concerns? I will hopefully hand over to Shamim Nabuula, and we can hear a little bit more about that as well.
Wow. Thanks from all my colleagues. They've really said very, very, very important issues. And I have so little to add. And when you talk about the Black community again, we have to emphasize what is it going to do for the Black people. And it's about training models and then the algorithms that include the Black people. Because if we are not trained, the Black people will not be recognized, as the examples that have been given by Shakir, that realize that someone would want to access the services, but then the AI is not recognizing them. It is not their fault, but it's because there were less Black people who were there to train the models that were needed. And then maybe they did not prioritize it, because also prioritization. What do they love? What do they want to put into this? So that is also a very big sector in this, that the Black people should be also included into these researches, the training of these models, the algorithms, so that even the people that are not recognized, I mean, there are some, for example, I can give an example at the healthcare facilities. I mean, when you're training or using AI to offer services to people, there are some things that cannot be recognized, like someone is going to maybe put their maybe scan and then it's like, no, we cannot recognize that. So realize that after some time, realize that the model was not trained with the Black population or the Africans or any other person. So this is like a loop that is there. And then for this, it's all about us, the Black people, being more inclusive into all these technologies, that so that we are not left out, because people usually look at prioritizing what is good for them. I mean, what is bringing positivity to their businesses, to what, but then how about these people that are of a minority? Yes, even if they are bringing in less, but they are also people that are supposed to be included into the different sectors, so that all that becomes complete. I mean, the diversity is what is needed for everything to take place. And then another thing I would want to emphasize is that the data, most of the data is, for example, if you're looking at the research that's usually carried out, they can say Africa, for example, maybe an example of maybe Africa and then Middle East, you find like the statistics is being added with another. That means they do not have that actual. And even if they would have that, the prioritization is on to some other race or something. So that is where the services, or where they believe they would get more impact or something. So this is something that really affects the Black community, because if you're delivering healthcare services, I mean, if the research is just showing 2 of you, but what is that specific that is going to be delivered to that community? So that brings a loop in that you're going to just be providing the services, but then you're not again tackling onto that Black person or the population that you're going to incur. So it's about including the Black people into that AI sector, and then being able to train also the Black, because I believe that we can do better. And then, yeah, I mean, we have all that knowledge and all that. So I think it's all about including the Black people in all the models that are trained, even in that data, because everything is there, and it's about prioritizing us into this. Yeah.
Thank you very much for that perspective. And we've heard, I think, a range of examples as well here, which has been great to hear. I'm cognizant of time here. There are a couple of questions in the chat. So maybe I'll just quickly see if anybody wants to pick up on them. So one is, can AI be accurately used to increase diverse representation? So we've been hearing, obviously, the lack of data representation. Does somebody on the panel want to pick up that question?
I think that I don't know if it can be used to increase maybe diverse representation, but maybe it can be used to detect a lack of diversity, or at least that's how I see a possible use case currently. But I'm not sure if it can be used to increase diverse representation, but definitely it can be used for detecting a lack of it. Or that's what I would like to do, to be honest.
Anybody else have another perspective on that they'd like to share? Mavis.
I think that's a great question. And kind of, for me, comes back to that question of what do we mean by diverse representation? I agree that the more we start broadening out categories, the more we start to see who's missing, and that just as Jerone is saying. And maybe after a while, we'll be able to, I don't know, map everybody and code everyone that exists in a particular way. And I don't think that that's a good thing to do, because the more we try and categorize people, the less we lose in terms of what actually makes it important, right? So there's something about categorization that also loses kind of that human meaning of it. So it's a difficult question to answer, and I'm probably just skirting the issue, but I think I agree with Jerone that it's probably quite difficult to do. It can only tell us what's missing rather than bring everyone
in. Great. So we are near the end, and I would like to give a chance for the panelists to sort of share what their key messages for the participants, what you would like them to take away from what we've been discussing, recognizing, you know, lots of points have come up, not just in, you know, how the Black community can really ensure that AI is being developed in a more responsible, inclusive way that does benefit their community and the wider society as a whole, and issues around inclusion and how we define this and data representativeness. So taking away from everything that's been said, we're going to go through each of our panelists, and if you just briefly share final message, what would it be, or key takeaway? I will start with Jerone again.
I guess maybe my key takeaway would be make sure that like the task that you want to actually, so for instance, if we're going to be using AI for things, then the best to make sure that the task you actually want to do has some kind of scientific validity, and also ask why you want to do it and will it benefit society, because that's why we make tools, to make people's life, improve people's lives, not make them worse. So that's it.
Thank you. Shamim, Nabuula?
Yeah, I think my key last message is that when we're developing these models, we have to remember that we have to include all the different races, so that there is increased diversity, and that is what will help the different communities be impacted. So that someone cannot find that, you know, I tried this and then it's not recognizing me, it's not doing this and that. So it's about the inclusion of all the different models, training AI with all that is required so that you can be able to deliver to all the different people in the different communities without prioritizing or categorizing some few and then leaving out the other, because at the end of it all, we are all in need of these services, we're all in need of AI to help us lighten in the work that we do, because AI is here to make things easier. But then if it is being prioritized or categorized onto the different races or a different category, it will not be able to bring in what exactly people would want to hear or be experienced with it. Yeah.
Thank you. Mavis, I'm going to turn to you.
Thank you. So I think for me, it's remember that society is unfair and unjust, and data is not objective. So question what is in the data. Remember that the things that we have recorded have historical biases. The things that we know about Black communities or people of color are influenced by what people were able to record or were allowed to record. So question that. And as you think about building models on these data sets, question what else might be missing.
Thank you. I feel like that's a good segue to Shakir, but not that I know what he's going to say.
And I suppose a few of my key messages. from the previous question that we asked, when we asked the question, can AI be accurately used to X? I want you to stop at that point and remember that tech solutionism, where we think that the best solution for any particular problem must be to develop some new AI, must be a point where we stop and think first. Because if we always think that the best solution is to create some new tool, then actually that's where the problem begins, that we just reproduce the problem. And then we have to undo problems that didn't need to happen. So tech solutionism, and just to be careful of tech solutionism. In Black History Month, that's so important. And LGBT History Month that's happening in the US and Canada right now. Remember, the histories of communities of people who are not like us are our histories as well. And they will tell us so much about harms that have happened in the past and how we can continue to make better solutions and better technologies in the future. Please keep asking questions of diversity, even though we as a panel were being very difficult to say, what do you mean? Please keep asking questions about inclusion, even though we said, well, what do you want to be included? Please ask questions about who is participating, even though we said, well, you know, you have to be very careful about who is at the table, who is asking these questions. Ultimately, I want to end by just saying that all of you on this panel are part of the accountability have power to hold people to accountable to build better technology. So please use our voices collectively. Let us organize in different ways. Let us teach each other new ways, connect each other with different kinds of communities, and then actually build the kind of AI, use the kind of machine learning, connect the kind of data that we think will actually help solve some of those complex global challenges we are facing, whether it is climate change, whether it is building healthier and creating healthier lives, whether it is addressing poverty, or any of the things that sort of matter to all of you, as this pandemic year has revealed to all of us. So thank you, panel, and thank you for letting me have the last one.
Thank you, Shakir. I mean, what a powerful set of key messages to end with. And I really like the idea of keep asking questions, really. I think that's challenging the status quo. And that's what's important. So on that note, because we're a minute over, I'm going to say thank you to all the panelists. Thank you to UCL for organizing this event, and to all the participants, audience members for joining us.
Thank you.
That, I'm handing it over to Sharon.
Thank you very much. Thank you. If everyone wants to give a round of applause to our fantastic panelists, I think they were all amazing. It's been a real honor to have the diversity of experience and knowledge shared here as well.